My name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in sports medicine. Today we're going to talk about rotator cuff tears. We typically categorize rotator cuff tears into two big categories. Number one is acute or traumatic rotator cuff tears, and the second is degenerative or more chronic rotator cuff tears. Degenerative or chronic rotator cuff tears are very common. In fact, 60% of people over the age of 60 will have some level of a rotator cuff tear. Acute or traumatic tears typically happen in a younger population, but can also happen in the older population as well. Usually these tears are from some sort of injury, including a fall or carrying something heavy, which is unexpected. Regardless of the type, patients can often present similarly. The typical hallmark of a rotator cuff tear of the shoulder is pain. Patients will often complain of pain worse at night and an inability to find a comfortable spot. Acute or traumatic rotator cuff tears may also present with an inability to elevate or raise one's arm above the level of the shoulder and weakness that is very different from what they had prior to the injury. Chronic rotator cuff tears may not have as much weakness or dysfunction in terms of elevating their arm, but this is variable. Regardless, rotator cuff tears can be quite debilitating for a patient. Initial conservative treatment efforts include rest, icing, physical therapy, and anti-inflammatories. If that fails, some patients may be eligible for injections. We've recently steered away from repeated cortisone injections as the cortisone may actually weaken the rotator cuff tissue. After failure of conservative treatment, patients may be candidates for surgical management. Rotator cuff surgery has come a long way. Recently, we've developed newer ways to treat rotator cuff tears that are less traumatic to the tissue and more biologic. There have been recent findings of bioinductive implants. These collagen-based bioinductive implants can help promote healing in the rotator cuff tears without the restrictions of prior generations of rotator cuff repair surgery. If you're interested in hearing about more about rotator cuff tears as well as management, please don't hesitate to reach out and schedule a visit. I look forward to meeting with you.